Previously on MDA.
Why are you being like this?
Everything I did. I've been a friend, your lover, and you've been a lawyer.
This sort of thing's out with.
Don't worry, Richard. Your reputation's not at stake any longer. Nothing is.
Do you want some time off?
No, Richard, I just want to work. I came here to work. I just want to bloody work.
You eat by the clock,
I eat when I'm hungry.
and that just happens to be at the same time every day?
You've really got a problem with the notion of self-control?
Not at all. I fantasize about it. Amanda Mackay.
Experience. That's what counts.
Assuming you're given the chance to get some. You're taking over the case, aren't you?
Yes. It's a big case for the firm. It stands to set a precedent. Of course I'll be instructing solicitor. This is another important victory for patients' rights. Justice Perry said doctors have a duty to warn a patient of all the risks associated with medical treatment. Mr. Gosper failed Mrs. Rosenborn there, plus he failed to disclose to her his level of experience.
True friends, on the other hand, are always there. And Ella, you have always...
To Ella.
Yeah.
To Ella.
Yeah. Ella.
Cheers.
Good
All
luck.
the very best.
Melissa,
Layla Young, hello.
I thought it was you.
Been a while?
Yeah, probably not since the formal.
The formal, God, night of the 100 vodkas.
How are you?
Over my hangover. Just. You working?
Yeah, legal secretarial in medical indemnity. It's good. I like your hair dark. How's your sister? I always look for her name in lights. She was fantastic.
She's okay.
Did she go overseas?
Ma. You obviously never heard.
Heard.
Melissa. Melissa, could you take Jodie for a walk? I just have to get to the chemist.
She was studying drama and working part-time at St Mark's in admin when she broke her leg and the hospital gave her pethidine. She got hooked. Kept saying she was in pain. They should have known after a while.
Did anyone ever tell her pethidine's addictive?
Doesn't look like it. Anyway, things just got worse. She lost her boyfriend, lost her job. Mum got her in to see a psychiatrist who didn't want to know anything about her. Got her transferred into a detox clinic, Emerton House.
I've heard of it.
Who let her walk straight back out again? So she ends up at that medical centre where all the junkies go.
Green Street.
Stole the sheet from a doctor's prescription pad, wrote herself a script, went to the nearest pharmacy, and that idiot filled it.
The pharmacist shouldn't have filled it. They're supposed to check.
She had user written all over her. All he heard was the ka-ching of the cash register. I keep telling Mum we should sue the pants off him. Got some advice from Legal Aid a while ago, but they said don't bother.
You should bother. I really think you should. Cases like this get heard all the time.
Well, you work in this stuff. Tell us who's a good lawyer, who can help us.
I just want it settled quickly.
Richard already said it's going all the way. He said you won't get all the defendants to agree at mediation.
No. I said it is likely to go to trial, but not definite.
I don't know how Jodie would go in court.
Ma! Don't, Jodes, cool it. It's okay.
She can tell that I'm worried. At first, we thought she might be, well, more able to communicate.
But she's not. So how are her self-help skills?
She can wipe her nose.
You give her the tissue and tell her what to do, Mum.
The bottom line is she functions as a 2-year-old who can barely talk and can't walk.
The major complicating factor here is Jodie. Now, a jury may well find that she is responsible for her own actions.
It was them. All of them. I mean, they're professionals. They must have seen how she wasn't in control. They should have done something.
Well, that is the line I'll be pursuing during mediation and in court if necessary. Whilst I think we've got a good case, a positive outcome is not guaranteed here.
Ma, I'm sorry.
Ma.
I'll take her down to the car.
No, it's okay, Mrs. Maurice.
I know. You're very kind. It's just that I worry about Jodie and all of this. She deserves some dignity.
Must be very hard for you.
The doctors say that thing that she does trying to get off her clothes is because of the brain damage.
Sure.
That's not the least of it. We're lucky to get 2 unbroken nights' sleep in a fortnight.
I understand.
She deserves compensation. We all do.
And the consultation was about?
She thought that she had thrush.
Of the mouth or the vagina?
Of the vagina. So, I took down all the details and I wrote them down and then I just carried out the internal examination.
So, Daniel, your supervisor, directed you to do an internal?
Well, I had asked for a supervisor to be there, but it was really busy. I mean, you know what it's like in emergency. Besides, her symptoms, I mean, the way that she was describing them, it sounded more like a trichomonal infection than thrush, so I thought I should take a swab.
But there was a nurse present during the examination?
He forgot he was supposed to.
Look, I didn't do it. I mean, all the stuff that she's saying that I didn't do it.
What exactly does Miss Pirelli say that you did? This is what we got from her lawyer. That Mr. Cooper's vaginal examination took many minutes longer than she had ever before experienced.
And I'm only learning.
That he twice inserted 3 fingers simultaneously into her vagina.
I definitely did not do that.
That he circled and caressed her breasts and nipples with both his fingers.
That's a breast check.
Why did you do a breast check when she came in with suspected thrush?
Because she asked me to. I was just being thorough.
That he appeared to have an erection while performing these actions.
I did not. I mean, she's making all this up.
Why do you think she might say this?
This woman saw an opportunity to take advantage of the system, and she's pounced on it.
What is it you want from MDA, Mr. Cooper?
Well, the hospital has hung me out to dry over this. They're saying that I acted outside of the rules for student doctors.
Our family solicitor doesn't have any experience with medical litigation, but I remember Daniel telling me about last year's med dinner and someone from here gave a speech.
Yeah, this old guy with a white buzz cut.
That'd be Mr. Bill Henderson, our senior case manager.
Well, he said that MDA should be our first port of call if we ever got into any legal trouble.
But you didn't take up a student membership.
No, I meant to, but...
Well, he can join immediately if you like.
Just backing up a step or two. You sent the swabs from Ms. Forelli to pathology?
Yes, of course.
And?
They came back clear. She didn't have anything wrong with her.
Medical Defence Australia, Layla speaking. Yes, Sarah, I'll just put you through. Happy? Sarah.
Ah, Sarah. Having been accused of ignoring my son Jason with some justification, I'm now taking an active interest in the lives of my daughters.
Right. And it's going well, is it?
Yes, Sarah seems to be responding to my paternal input now. Sarah. Yeah, wait a minute. I thought we agreed that you would not use the mobile except for an emergency. What? Now, miraculously, your mother and I are in harmony on this. Now, look, I don't care if the whole student body is going to this steamy gathering. You, young lady, will be enjoying...
Thanks, Mrs. Cooper. We'll get back to you later on today. Thank you. We appreciate all of your help with this. We don't know what we would have done.
No, the answer is still no. Go to class. See you tonight. Well, she did ask my opinion.
Sure she appreciates your input.
Goodbye.
Bye, Daniel. You clearly didn't believe a word he said.
I'm sorry, no. There were a hell of a lot of things he should have done that he didn't do.
There are. He certainly didn't hide the fact that he fouled the protocols. He didn't consult a supervisor. He should have had a nurse present.
Well, not to mention the fact that he's not even a member.
Also true. But there is the bigger charge of sexual misconduct, and on that count, there is reasonable doubt.
Not in my mind.
Well, I'm glad you're so sure.
Hi there. My name's Dean Conroy. I'm a member. I'd like to talk to someone about a writ.
Sure.
Hi, Jamie Lawless. I was at a seminar at Green Street Medical Centre last year. We spoke afterwards for a bit.
Of course, yeah.
Are you still working there?
Yeah, look, this has turned up.
All right, well, why don't you come through to the interview room? So, do you recall Jodie Maurice?
Yes, I do. I last saw her 2 years ago, though.
I didn't think that any of our members would be implicated. I thought it was only going to be the pharmacist.
I hope this girl you advised is a close friend of yours, Layla.
Well, not really, no. I mean, she was a year above me at school. We were never that close. But Jodie was pretty amazing. You know, she was a couple of years younger, but everyone knew her. You know, she stood out. She was one of those people. If we were all doing what we were told, she'd be arguing. You know, she'd be pushing stuff. And now she's in a wheelchair. She's gone. And I just wanted to help. I'm sorry if I've caused problems here. I am sorry that one of our doctors is involved. I honestly thought it was just going to be the pharmacist.
Layla, I'm saying it's
From what I could
don't-
tell, the pharmacist did make a big mistake.
Layla, if a patient is entitled to compensation, they have a right to claim for it.
That's what I thought.
Yeah, what bothers me about this case is the plaintiff really only has herself to blame.
Well, that might not be completely true.
Happy I took this for you.
Mm-hmm.
Also, when you've got a moment, Simon and I wouldn't mind a word with you about Daniel Cooper.
You realise I don't have grand final tickets, you lot.
It can wait.
It's going to have to. The psychiatrist who saw Jodie Maurice has also received a postman's knock from Richard Savage. He's on his way in. I better go and talk to Jamie.
I've just got this video from the Maurices. Take a seat.
Yeah, actually, I've got to go.
Well, it won't take long. Could be useful for mediation in court.
Our soldiers are always beaten because they are fighting to save their skins. And the shortest way to save your skin is to run away. Our knights are thinking only of the money they will make in ransoms. It is not kill or be killed with them. It is pay or be paid.
St. Joan. So there's some good stuff further on as well, if you want to...
I've got a mediation to prepare for.
What is it?
Sexual misconduct. My client, Rosanna Forelli, was taken advantage of.
Right. So how are you feeling anyway?
I'm fine.
If there's anything you want to talk about or...
There isn't.
Most of the veins in her arms had already collapsed. She was shooting up into the back of her hands. She was withdrawing badly.
And was this the only time you'd seen her?
She said she had migraine. They all say that. Or kidney stones. Something that they know will result in them getting pethidine if they can carry it off.
But you didn't buy it?
So then she confessed she was an addict, broke down, started sobbing, begging for help.
But she was still asking for drugs.
Oh, yeah, it's part of the scam. Addicts will confess everything and then ask for a small amount to start weaning themselves off. They'll go to half a dozen other doctors with the same story.
I see. So her remorse was all an act?
No, I think that, like most addicts, she was genuinely ashamed. That's what makes this scam harder to resist. But, I don't know, I've only seen it maybe 400 times or so. Anyway, I did what I usually do. I spent about 40 minutes with her, talked about various treatment options, checked her general health.
Which was pretty poor by the sounds of it. Underweight, ulcerated gums, bronchial infection, suspected hep C.
Standard presentation, but she asked about counselling. And so I went to the door to ask the receptionist for an address. I didn't actually leave the room. And while my back was turned, she pinched the top sheet from my prescription pad.
By coughing to cover the tearing sound.
I had no idea that she'd done it until the police traced the drugs to the pharmacy and the script to me. I really fucked it up. This one's my fault. Mind you, it couldn't have happened today. The whole centre's now been computerised. Until we could afford that, I was literally carrying the pad in my pocket the whole time.
Well, the volition on the part of the patient makes her actions more or less indefensible. Yet Savage has seen fit to bring this to mediation.
What's his angle?
Oh, we'll find out soon enough.
Excuse me. I'm happy Dr. John Alfano's here to see you.
Thanks, Lola. I'll just be a moment.
We can't wreck this guy's career on a gut feeling, Simon. In a few years' time, he could make a good doctor.
He could make a gynecologist with a client list full of vulnerable women.
Ah, Dr. Alfano. Come through.
Okay, look. Say I came in here and said to you, Simon, I think I found a lump in my breast.
What, you?
Yeah. And I said to you, can you do a breast check on me, please? You'd say...
Well, if you didn't want to go to your own doctor for whatever reason and you just wanted to...
you don't have to stare at them.
Oh, I wasn't staring at
You're
them.
thinking, wow, might get to feel a tits here.
Okay.
Hey,
no.
Layla.
Layla.
Pretend you're a judge. I'm trying to have a serious talk about breast checks here, and all he can do is stare at me as if I'm topless. Technically, that's sexual harassment, right?
I don't know, it's a bit gross.
It's not... Let her hear both sides of the story, okay? There is such a thing as presumption of innocence, by the way.
Oh, so we believe in it now, do we? Thanks, Layla.
Being entitled to your legal rights is one thing. Being entitled to indemnity when you're not even a member is another thing altogether.
Medical Defence Australia, Layla speaking.
Jodie was as sick as a dog, withdrawing badly. She needed concrete physical intervention and care before anyone could address her mental health. It'd be like trying to fix a grazed knee before a lung transplant.
And did you explain this to her?
Of course. But given her attitude, I doubt that I made much impact.
I notice here that you saw Jodie Maurice for 15 minutes. That's quite a short consultation, isn't it?
When Jodie's mother brought her to my rooms, Jodie was abusive to her and to me, and then in turns unresponsive and aggressive.
And what was the reason for this behaviour?
Oh, she wanted another pethidine, plain and simple. It consumed her.
Sorry to interrupt. I've just seen Dr. Conroy out.
Good. Dr. John Alfano, this is Dr. Jamie Lawless, who will be assisting me on this matter. OK, back to Jodie Maurice, who was unresponsive and aggressive. What was your recommended treatment?
I referred her to Emerton House, where her withdrawal could be assisted.
But they let her walk out?
Yes, so let this savage person sue Emerton House if he must. Look, however tragic Jodie Maurice's condition, I did nothing to contribute to it. MDA does not owe her a cent on my behalf.
Okay. Yep, thanks for that. Bye. That was Great Northern's legal service. Apparently, Rosanna Forelli reported Daniel Cooper's alleged indecent assault to the police.
Oh, he failed to mention that little detail, didn't he?
They decided not to proceed. Insufficient evidence. Makes defending him a little bit more palatable.
Depends on your taste buds.
Rosanna Forelli was in a busy hospital emergency room. All she had to do was call out and somebody would have heard, but she didn't.
It's a specious argument, Amanda.
Zero tolerance of sexual misconduct is all well and good. But push that just a little bit further and you're effectively saying that a doctor can't examine his patient properly, much less be normal, friendly, supportive.
Can you understand how difficult it is for a woman to go to a police station? Put yourself in her shoes. Something drove her there.
Yes, a fumbled examination by 60 medical students.
The difference between an internal examination and sexual misconduct is clinical protocol, and he didn't follow it.
And Rosanna Forelli didn't complain until after.
Yeah, but she did complain.
Thanks for coming in. We'll be in touch.
Undoubtedly. Thank you.
OK, so, Emerton House, St Mark's Hospital.
The pharmacist, our two. Conroy and Alfano. 5 defendants. Richard is casting a wide net.
Although with our 2 members, the claims are without merit. Keeping that pennant of truth erect through the jostling of the other 3 defendants is going to be the hard part.
I'm glad you're the lawyer.
Well, thanks for the vote of confidence. Savage must be feeling that all his claims have some weaknesses, though.
So our approach is?
In an ideal world, we'd offer them nothing.
The 3 other defendants clearly have a greater liability, though.
Well, I damn, but considering Jodie Maurice chose her own sordid path, but yeah, their defences will be weaker.
Yeah, well, when it comes to Savage, if there's a jugular in sight... Look, Dean Conroy made it pretty clear that he wants this to go away quietly.
Well, Dr. Alfano was just as clear about being prepared to fight.
Yeah, a fight all the way to court, where he would alienate every jury in the state. And Dean Conroy's not going to be a very good witness for us either. He feels responsible, and he's too ready to admit failure.
How well do you know him?
Only by reputation. I heard him speak about drug rehab last year. He does have a brilliant reputation.
But he's too ready to admit failure.
That's the way he came across today.
We're going to have to concede his negligence in turning his back on Jodie Maurice and letting her steal a page from his prescription pad. That's an established fact.
All right, so then we should go into mediation prepared to offer something. We should be looking to get him off our members' backs. Richard will know that he can get far more out of the pharmacist and the clinic and the hospital.
OK, well, we've got to get them all in here ASAP and see if we can sort out some sort of consensus on an offer.
I'm just saying that the pharmacist's position is that we have no liability in this case.
Margaret, it doesn't take a legal genius to guess that will be the line we all take, but realistically, is it the line that we should take?
MDA can offer all you like. St Mark's is prepared to offer nothing.
But is that nothing or nothing?
It depends how you measure nothing, Joe.
Your zeal is commendable, Klaus, but experience leads me to suspect that some sort of sharing arrangement is in order.
Which would be very much the Emerton House advantage, wouldn't it?
Excuse me, can we be realistic here? We must go into mediation with a figure in mind and some idea about which proportion of that figure our clients should carry.
Exactly. So let's say, for argument's sake, a figure of 500,000.
It's robbery.
We have to be pragmatic about this.
I'm always pragmatic.
I see. Right. And that's all you can tell me, okay? Right. Thanks a lot. Bye. Richard.
So you're talking to me now, eh?
What? That was the police.
The police?
Yes.
Oh, right. So the police bothering you, are they?
Oh, you mean about the Justin Harris
Yes.
thing? No, and if they were, it would be of no concern to you.
Well, it would actually, but
No,
that's...
it was my client, Rosanna Forelli. Sexual misconduct.
Mm-hmm.
She's reported this creep student doctor to the police.
He's a creep.
Well, obviously. She reported him to the local police station, spoke to some policewoman, who then spoke to Cooper for about a minute, and then told Miss Forelli there was not enough evidence to proceed.
Right, so no witnesses, no physical signs, his word against hers.
Yeah. So it's not a criminal matter.
Okay, do the other side know about this?
Well, obviously I have to tell them.
Right, well, you'd better hope they don't bring it up, but they will.
The fact that she went to the police, I mean, it proves something, doesn't
Yeah,
it?
I mean, it supports your case, yes, but it doesn't prove anything.
Can you imagine putting yourself through that? I mean, going to the police in the middle of the night and lying to some bored cop. I've just been molested at the local hospital. I don't think so.
It has been known to happen.
Bullshit, Richard.
What is this, Caitlin?
You haven't even
No,
met her.
listen. You have to anticipate the opposition. You've just got to stay calm about
She went to
this.
the hospital one night expecting one thing, something she had every right to expect, and what does she get? Some little pervert. You know, and why did he do what he did? Because he could.
Are you sure you're in the right frame of mind to handle this? Because I can.
I'm fine. I'm fine, thank you.
Now, let me see if I'm understanding this, Simon. You're saying that you're fairly convinced this Cooper fellow was guilty of sin.
I think he exploited a convenient situation, Bill.
Yet, Amanda, you want us to represent this deviant.
I don't.
I think there's reasonable doubt he's been falsely accused. And if we did take him on, we'd have a member for life. More than one. I'm sure a young bullfed like Daniel Cooper's got 30 mates in his ear, all looking to join an MDO in the not-too-distant future. Imagine if he told them that MDA took him on when no one else would. He'd spread the word.
So we defend him as a public relations exercise.
Well, MDA's been bleeding members since the reinsurance debacle and the call. And this guy sought us out.
With good reason. Because his hospital rejected him and because his own solicitor has got no clue about MedNeg.
But Hap, the investigating police found insufficient evidence of sexual misconduct. And there's no proof that Rosanna Forelli isn't maybe trying one on.
So what damages are they seeking?
Unspecified.
May I? So the solicitor representing Miss Forelli is one Caitlin King.
So what do you think?
Well, I've got no doubt that you could best Caitlin's arguments, whatever they are, and the goodwill generated by taking on the young medical student would probably be worth our while.
You don't think we need a better reason than goodwill?
Well, this is on two conditions. First, that we only pick up the indemnity to a level of 15,000.
I think we could get away with less. I mean, if we maintained his innocence on everything except that he failed to act under supervision.
Oh, really? Money will be changing hands, it's inevitable.
And the second condition?
That the boy pays the rest.
But he's a student.
Well, him, his mother, his aunt, his goldfish, doesn't matter. Do not represent him unless we get that in writing first. Put that to our young Lothario and see if he still wants our help. If so, you have your publicity coup.
That's great. That's fantastic. Thank you.
Yes, thank you so much.
But we'll only indemnify you for $15,000.
But I thought...
I've joined MDA.
Yes, but you weren't a member when the incident occurred. We've taken your case on as an act of goodwill. However, there is a limit to our goodwill. We estimate you'll be up for between $5,000 and $20,000.
But, I mean, isn't settling the claim like an admission of liability?
It also ensures you clear this and that you can continue with medicine.
The facts of this case being what they are, Ms. Furley's solicitor will be expecting a reasonable settlement offer. The facts being what they are.
Settle.
We happen to know this particular solicitor.
And so we, MDA, should pay for this girl's decision to inject narcotics into her veins.
I'm confident that we can keep our offer to a minimum.
I don't care how small it is. It's rewarding self-harm. Part of treating addiction is the addict owning the problem.
This is an unfortunate case, whichever way you look at it, but the way I see it is that you definitely are the victim. But the fact is, there are going to be damages, and it is our task to minimise them. Reluctantly, we concede that token offer is the least damaging, disruptive way to go.
Thank God. Let's just get it over with you. You know, frankly, I'll be glad to give her something. Addiction's a disease, it's not a lifestyle choice.
But you did try to treat her.
I didn't do enough, though. To listen to him. Fuck, you'd think Jodie and Maurice wanted to end up brain damaged.
Five defendants, Layla. 2 medical practices, a pharmacist, private clinic and a public hospital. A chain of events spanning over 2 years. The common denominator, Jodie Maurice.
But hang on, you would have to think of Jason, wouldn't you?
Of course I do. I mean, I'm fully aware that he was headed down a destructive path and he came very close to using serious drugs, a lot worse than just pot.
Doesn't that make you empathise with Jodie's family?
Layla, if anyone was going to become a drug addict, my self-absorbed, indolent son was, but he didn't, and it wasn't just because of my parental intervention, I can assure you. He chose not to. Jason chose not to.
But maybe Jodie wasn't able to make the time.
Join you?
Yeah, of course.
Beer?
Sorry, I'm just saying maybe Jodie wasn't able to make that choice.
She could have stopped using the moment she became aware that she wanted to.
You didn't stop smoking the moment you became aware you wanted to.
That is a different drug, different circumstance. If you found yourself scamming doctors, duping pharmacists to get a fix, you'd know you'd crossed the Rubicon. You'd have to face the fact that you are now operating outside the socially accepted norms.
I'm sorry, can I just clarify something here? We're talking about a disease.
It's not a disease, for God's sake. I mean, you can't catch drug addiction, can you? It's not whooping cough. People make choices. Jodie Maurice exercised her freedom of choice. No disease, just bloody-mindedness.
Oh, is that right, is it?
Takes commitment to be a junkie, doesn't it? Determination to use time and time again. Commitment.
Commitment? About low self-esteem, lack of life skills, possible past abuse, genetic and social predispositions, any number of mental illnesses. It doesn't take just one thing, Bill.
Dean, just leave it.
Do you have kids?
Yes, I certainly do.
God help them.
It's that argument that addiction is a disease that I object to. The deviant that breaks into my house and steals my VCR is not sick.
Happy, when Jason collapsed in the toilet last year and Layla and I had to get him out...
Yeah, he was not sick.
OK, he wasn't injecting narcotics, but he looked pretty sick to me.
It was choice, Jamison. It's the ramifications of choice.
And what? The hell with any notion of chemical imbalance or psychological disorder? You blame it all on Jason, do you?
No. Me, as a matter of fact, I blame a hell of a lot of that on me. All right? It wasn't just the choices he made that caused that behaviour, it was the choices I made as well. And I know it has taken me a long time to see that. But now I get more than a little bloody angry when I see people blaming everyone else for everything and never looking at themselves.
Should be all over by lunchtime.
I hope you're right.
Jamison, I expect you to remind Dr. Conroy that he won't be needed at mediation.
Why me?
I'm pulling rank.
Okay. Listen, sorry if I mouthed off last night. It wasn't meant to be personal.
The heated debate is character building.
Listen, you don't need to be here today.
What, meaning your boss doesn't want me here?
No, really, it's not necessary. Most members prefer to leave it to us.
OK, I won't go. I'll go to the medical centre. Let me know what happens.
Yeah, OK. Listen, you ever thought about taking some time off?
Mate, at the moment I'm thinking about changing jobs.
Practising somewhere a bit quieter?
Then I can't see myself dispensing flu jabs in suburbia. I think about it sometimes. But honestly, there's so few of us now and so much need. If I bailed... Anyway, let me know what happens.
Yeah.
I have heard the tales of the Black Prince. The moment he touched the soil of our country, the devil entered into him and he became a black fiend.
This is a tape from theatre rehearsals a week before Jodie broke her leg.
By God, he was good. It is always so.
And this is Jodie today. Every single one of your clients contributed to this bright, active, talented young woman being in the parlous state you see there.
You're ignoring the inescapable fact of your client's own part in her downfall.
Daniel, is there anything else you're withholding from us?
No, it was just the thing with the police. That was it, really.
Ready to go, folks? Yeah. We'll confirm any offer we make, Mrs. Cooper.
If it goes past the 20 that you said, you'll need to let me know.
Sure.
Will you be with us?
I don't have to.
No, but it's your right to face your accuser.
No. Thanks, I keep my mum company.
I suppose the main thing is that I don't trust people anymore. It's like I went to the hospital that night just trusting, expecting, you know, that people do the right thing by you. So when he did those things, I just couldn't believe he was really doing them. I just couldn't believe it was really happening. I mean, he's a doctor. And then afterwards, I felt so sick. And I kept thinking about it. I don't even trust my own judgment anymore.
Thank you.
My client has suffered greatly because of Mr. Cooper's actions.
How?
She suffers nightmares, insomnia, has flashbacks to the assault.
Alleged assault?
She suffered great personal loss. Her relationship failed in recent months.
Relationships fail all the time. Who's to say the relationship might not have ended anyway?
Miss Forelli's quality of life has been severely diminished. She's had to take time off work.
Has she lost her job?
Oh, she's on stress leave.
So she's not actually out of pocket. Has she incurred any medical costs?
I think you should broaden your view beyond the financial. My client has acute emotional stress. Does that not count in your book?
Oh, it counts, if it's measurable.
We're seeking damages in recognition of your members' failure to act professionally and compensation for Miss Forelli's emotional pain and suffering.
Or do you have a figure in mind, Miss King?
100,000.
Right. Well, we see things a little differently.
St Mark's hospital staff acted with complete professionalism.
They continued to supply her with pethidine months after it was needed. They never warned her that pethidine was addictive. Never suggested counselling even when they realised she was addicted.
St Mark's is a busy public hospital, not a drug rehab clinic.
That would be your client, wouldn't it, Mr. Webb? Jodie Maurice. She was the third patient you've let wander out of Emerton House.
We're not a prison.
You advertise a secure inpatient service.
Upon admittance, our clients agree to follow certain conditions.
Oh, right, okay. And Jodie was in a fit state to understand that, was she? And your pharmacist, hadn't he filled in hundreds of scripts written by Dr. Conroy? Why didn't he notice the difference in handwriting? Did he even bother to check the signature on the script? Now that could be the most negligent point of all, couldn't it, Mrs. Kibble?
I know what you're trying to do. You're not going to pin this on my client.
Who snuck out of Emerton House, Richard? Who stole a script? Who forged Dr. Conroy's signature? Jodie Maurice's voluntary acts take precedence over anything that our clients may or may not have done.
These people are trained to help people like Jodie. That is their job. My client was crying out for help.
Oh,
No,
please.
I don't want to hear this crap about it's all her fault.
She lied and stole to get her hands on illegal drugs, and now she blames everyone else for the effects
No,
they
no,
had.
no, no, no. Not everyone. Just the professionals who were there to help. I mean, this girl is in a living hell for the rest of her life because of all of your clients, and I mean all of them were so bloody careless that a sick girl who everyone could see needed help got none. None. Whatsoever.
Perhaps you people might like a moment to discuss some things amongst yourselves. Richard?
Sure, yep, go ahead. Apportion blame. Just as long as my client gets the compensation she deserves.
Ms. Forelli went in suspecting she had a vaginal complaint. She received an internal examination for that complaint, and Mr. Cooper did a breast examination on her request.
We're not disputing that. We're saying that his actions during these procedures were absolutely improper.
Then why didn't she say something at the time? Why didn't she ask him to stop, call out for help?
I was embarrassed. I was half undressed and part of me thought, okay, this is all right. But then the other part was like, it isn't. It isn't. I just froze. I couldn't believe it was really happening.
Part of you thought this is all right.
Which is not an uncommon first response in victims of abuse. Refer to Trauma and Recovery, Dr. Judith Herman, if you need to check up on it. And it doesn't alter the fact that Daniel Cooper abused his position of power in the very worst manner.
The fact is, you don't have any evidence that Mr. Cooper touched your client in such a way as to be an assault.
Does it not bother you that if he got away with it, it could happen again?
MDA knows that the police investigated Miss Forelli's complaint and found insufficient evidence to proceed with a criminal investigation. If you take this to court, it'll be a civil action without their support. And Miss Forelli, it will be your word against his. And like it or not, the burden of proof will rest on you, not him. And there is simply no evidence that an indecent assault took place.
The 2 breaches of hospital protocol alone constitutes gross negligence.
We're not disputing them.
All right, setting aside the indecent assault, what figure were you after there?
No less than 35,000.
That's all right.
We should offer less.
Oh, we're only up for 15. The Cooper's got a 420.
If we offer 25, they'll only be up for 10.
And you'd be comfortable doing that?
I'd be minimising damages on behalf of my client. That's what I'm paid to do. $25,000 all in. No admission of liability, and on the condition that Miss Forelli sign a confidentiality agreement over these terms. So, if you can get the check to
That'll
us...
be fine, sure.
Yes, I'll need 3 days to release funds from a term deposit.
3 days is fine.
She can't talk about this to anyone. She can't go to the papers or anything.
Any public discussion will render the agreement void. I don't think you'll be hearing from her again.
Oh, this is fantastic. Thank you so much.
Yes, thank you.
We won't be long. I've been a medical student and I've had these sorts of opportunities. You know, working flat out, all hours. Frankly, haven't had time for a wank in months, let alone a girlfriend. And then one night, you come into the cubicle and there's a pretty girl. And all you have to say to her is take your clothes off. And she does. And I'm going to touch her breasts now, and she lets you. The next time something like this happens, MDA will not extend its goodwill, whether you're a paid-up member or not.
For a supervising clinic that fails to supervise, Joe, you have to concede a large proportion of liability.
As should the indemnity organisation for the psychiatrist, who sees a patient for a full and fruitful 15 minutes.
I'm sitting on 15%.
Oh, you made that.
Dependent on our agreeing to the final amount offered.
Look, I thought I made it clear we're looking at $1 million, and we're starting with 500.
We're not going higher than 30% with a confidentiality agreement.
We'd expect MDA to match whatever we offer.
I'm not going above MDA's offer.
Well, your client's the one in the firing line, Margaret. This whole claim hinges on your pharmacist filling in a dodgy prescription.
He was last in a long line, that's all.
MDA is offering 10% conditional on you offering 35.
Our liability doesn't come close to that.
Look, we have got to start talking cash dollars soon because this is not going to go away.
Are we going to be able to work together?
I have no doubt about it. It was a good result for MDA. Mind you, we could have given her $35,000 and you still would have had your PR scoop.
We're supposed to go hard on all settlement negotiations, which is fine until you stumble across a moral point.
Which is going to happen when you stick to the letter of the law. Well, there's always a grey area, isn't there? I suppose I still do have a little bit to learn about legal process.
Is that a concession?
We were tough on Rosanna Forelli. I feel uncomfortable about it, that's all.
You mean I was?
I was on your team.
It didn't always feel that way today.
Could get a bit dull if we agreed on everything.
Be efficient, though. Isn't that one of your values?
Like self-discipline.
And that's your combined offer?
That's our combined and final offer.
Okay, I'll take it to my clients.
$500,000?
They'll have to come to some sort of sharing arrangement, different defendants paying out different amounts.
$500,000?
What do you think?
If they've offered, they're conceding they have some liability.
Well, it's wonderful. It would be a tremendous help.
What planet are you living on, Mum? What economy do you do your shopping in? 500,000 wouldn't last us the next decade, much less the next 50 years. 50 years, Mum. That's how long Jodie's going to live for, and every minute of every day she's going to soak up every cent we've got. So we either make this litigation worthwhile or we work like slaves for the rest of our lives. I want $3 million.
They're unlikely to offer that here.
Well, what if we went to court? Would we win?
Normally I'd advise against taking a case involving addiction to narcotics to court, but, you know, here I'm feeling fracturing on their side, plus 5 defendants. Not all are going to make good witnesses. However, I mean, there is a good chance that this case may still not go as far as court.
But if it did, we'd win?
Melissa, you can never predict what a jury will decide or what they'll award.
But $3 million's a possibility.
Yeah. In my estimation, yes.
Good. Do it.
Is that what you want, Mrs. Morris?
I don't know. It seems a bit extreme.
It's not. It's reasonable.
$3 million.
Are you serious?
Absolutely.
Out of the question, I'm afraid.
Do you want to discuss it further?
I've no intention of discussing it. It's patently absurd.
If you reconsider, let us know.
Court, it's crazy.
Richard felt very powerful facing down the 5 of us.
The testosterone was pungent.
Meanwhile, our 2 defendants are unlikely to present a united front.
Dr. Alfano, who has the bedside manner of Attila the Hun, and Dr. Conroy with his mea culpas, they will not make for a compelling defence, I can tell you.
This has all gotten so big.
Eaten all the chocolate ones, have we?
I think there might be one left.
How did you go?
Fine. 25. 15 for us, 10 for them.
Well done.
I thought so.
So I'll interview our witnesses, get some experts lined up, and then it's just a matter of waiting for a court date.
I know there are a couple of her friends that remember her complaining that Emerton House was really bad to her.
Good.
I'll call you with a list of names and numbers.
Mm-hmm.
And Melissa, we really should be getting Jodie home. She's been sitting all day.
But sitting's her best trick. That's what she does. Like a log. She doesn't understand.
Come along, sweetheart. Thank you, Mr. Savage. And thank you for all your help. Most of the world doesn't want to know about brain-injured people.
It's okay. You keep in touch, yeah? You okay with this? Can I just have a word for a sec? Yeah? Melissa, I just want to let you know how I see this case, right? I think we've got a good chance, okay? But there is one aspect that's worrying me. You.
Me?
Your attitude towards Jodie.
I don't know what you're
Hey,
talking.
listen, I understand. I totally understand how hard your life is. But the people we're up against are not fools. Bill Henderson from MDA is very cluey. He's very experienced. His line will be that there was no negligence because Jodie brought the OD on herself. Yes? Now, if he detects the slightest sense that the plaintiff's own sister holds her responsible in any way, he's going to sniff out your resentment and he is going to make it play for him. So if you've got any stuff on your chest about your sister, you know what? I'd get it off right now, well and truly, before you take the stand.
Oh, you ready?
I take the stairs.
Scared of falling lifts?
9.8 metres per second squared. First floor, maybe, 5 metres. 0 initial velocity. You'll live.
I'm glad to see you taking into account the gravity of the situation.
Jamie. G'day, mate.
Hi. You finished at the centre?
No, I decided against it. Listen, I got your email. Next stop court then, huh?
Yeah.
You feel like a drink?
Not tonight, thanks, mate. I've had it.
Oh, doesn't matter. No worries.
Well, maybe we can get together another night. What's your roster like?
No, I'm not. When I said I've decided against it, I meant permanently. I got to the centre today and I just couldn't go in. They say it gets to everyone in the end. There's one case that does it, one too many. I guess mine was Jodie Maurice. It's a dumbass little tricks, you know, the things they think you haven't seen and heard 1,000 times, the self-inflicted wounds.
Dean, you know, you do good work there, you know? I mean, when I heard you speak last year, you were fantastic.
Mate, I'm pissing into a cyclone. It's too hard. Anyway, it's no big deal. I'll catch you later.
Mel, hi.
Hi. That bloke you recommended, Richard Savage, he's pretty good. Probably shouldn't be here, should I? Breaking some legal ethic or something.
Yeah, we can go and have a coffee if you want.
I let her down. I let Jodie down. I used to get so angry at her for doing that to herself. You know, for doing that to us. Making Mum cry all the time. I could see what she was doing, you know, getting skinnier and desperate. Part of me was thinking, serves you right, selfish bitch. She always liked to push things, you know? Loved the rush. She used to slag me off for being straight, now look at her.
Mel, are you sure I'm the best person for you to be talking to
No.
about this?
But there's no one else. Don't have friends anymore. Mum can't hear it. Person I used to talk to was Jodie.
I'm sorry, but I have to say this. Whatever other people did or didn't do with Jodie, the 2 doctors you're suing, what happened to her was not down to them.
So? I mean, it's not their money. They're covered by you guys.
Well, it's not about money. You're accusing them of negligence, and they weren't.
Layla, my life is looking after Jodie. That's no career, no travel, no family.
I know, I understand. There's your mum.
She's not going to be around forever. And when she's gone, I'm Jodie's sole carer.
Would you consider a home?
There is no money. None. I can't do this on a disability pension and a waitress's wage. We need money. Jodie needs money. And I don't give a shit who Richard Savage has to sue to get us her.